She was admitted to my facility, and her admission diet orders were IDSI level 4 puree and IDSI level 3 moderately thick. And she was put on my schedule for an eval that following day, and I really thought I was prepared. All I needed to do was get an interpreter, right? Be sure I included foods in my clinical swallow eval that were culturally appropriate, right? Well, we're going to come back to Dolores, but this experience made me aware that I needed to increase my cultural competence in order to achieve successful outcomes for all my patients with dysphagia, regardless of their cultural background or English proficiency. And that's what I want to share with you. Looking at dysphagia management through a cultural lens just helps us to understand why patients think the way they do about our recommendations and why they may respond to events very differently from what we expect, even patients who we think are culturally similar to us. This illustrates how food rules are a potential sociocultural barrier, but here we also find barriers related to health beliefs and religious beliefs and values. Let's look more closely at these. In addition to the lack of access to preferred foods, the simple fact that these patients are now receiving meals offered in a healthcare facility means that their food rules are threatened. The temperature, utensils, plates, portion size, as well as all of the factors we discussed earlier that define the patient's food rules may come into play here. And when diets are downgraded, we alter food expectations like how the food should look, and this can affect the pleasure of eating. For health beliefs, there can be a lack of understanding of the need for dysphagia therapy or the belief that therapy is not effective, and even a misperception of the swallowing severity and how it should be treated. The misunderstandings do not necessarily reflect a language barrier, although we need to be sure to rule that out. Instead, the patient may have different cultural views of illnesses and how they should be treated. We're familiar with the phrase shared decision making. For a CLD patient, think of this as a cultural negotiation. Why? Because minimizing risk of aspiration may be paramount to us, but it may be of lesser importance to the patient who would rather accept the risk of pneumonia and retain the food and drink of choice that is culturally meaningful to them. So we must take care not to interject our own health values and respect the patient's family's choices. This doesn't free us from responsible ethical care, but it allows us to respect the informed decisions made by the patient and family. A culturally responsive view honors the decisions of a patient and family as reasoned choices rather than non-compliance. So once the assessment is completed, cultural negotiation can take place in terms of agreeing on a treatment plan that's acceptable to both you and the patient. The goal of cultural negotiation is to join our beliefs about treatment in a way that helps the patient achieve a healthy outcome, understanding that we may have very different views. So now you're asking, why not skip the whole learn about different culture step? Why not go in and just learn everything about culture from the client? Because we're trying to build a meaningful connection with them and coming in with some prior knowledge of their cultural background, that's going to demonstrate your move toward this. It's about cultural awareness, knowing ahead of time what kinds of questions to ask. It's about being honest with your patient and saying up front to your patient, I've had little experience working with Mexican American women. From what I've read about the Mexican culture, you might want your son to be with us during this assessment. Can I ask you some questions to help me better understand some of the things that are important for me to know as we work together? When it comes to understanding the unique experiences of any given individual, cultural competence is theory. Cultural humility is practice. It's not something we should do, it's something that we must do, and it was something I wasn't doing with Dolores. Let's move on to exercise 2, appreciating your multiple identities. And let me tell you the rationale behind this one. When working with clients from other cultures, we need to examine differences and similarities between ourselves and the client. By recognizing our multiple identities, we are less likely to stereotype others based on minimal information about another person's historical, social, and cultural backgrounds.